The carotid arteries that lead to the brain can become clogged with plaque over time, increasing the risk of stroke and even death. Now, doctors can insert stents into the arteries to increase blood flow rather than using surgery. With more information on this procedure is Dr. Subbarao-Myla of Hoag Memorial Hospital Presbyterian in Newport Beach.
Carotid arteries are the big arteries in the neck that feed the brain. A blockage in the carotid artery leads to strokes. Stenting is a kinder, gentler way to fix the artery instead of the surgery. It's a one-day stay in the hospital with the patient wide awake under local anesthesia. We insert a catheter to the neck through a tiny hole in the groin, and patient is wide awake. Procedure takes about 20 minutes. And during that time, we don't interrupt the blood flow. We stretch the blockage and put a stent. The carotid blockage is the main source of plaque that breaks loose into the brain to cause a stroke. So treating that blockage is the #1 safe method to prevent a stroke. Why is stenting better than surgery in some cardiac lung disease patients? As the heart disease is advanced and as we live longer, we build up plaque in the heart, have blockages causing angina, heart failure, recent heart attack. They are at risk for anesthesia and surgery. So those patients, when treated with carotid stenting, you avoid the morbidity of anesthesia and surgery because we only give local anesthetic, no cutting involved, so the healing is quicker. Anyone who can't tolerate the general anesthesia and a major vascular surgery are good candidates for carotid stenting. Can this be done after a patient already had a carotid surgery? Yes. In fact, 1/4 of our patients are referred by the surgeons. Scar tissue builds up and plugs up the area that the surgeon has repaired. That can happen 6 to 9 months after a procedure. So rather than take the risk of another major surgery and anesthesia, stenting is the treatment of choice for them. Most carotid disease is very silent, so it requires a dedicated exam, but simple stethoscope on the neck listening for the flow disturbance is sufficient in detecting significant carotid disease. But majority are best served by doing a carotid ultrasound. It's an inexpensive, non-invasive way of a sonogram. We can measure and accurately pinpoint how bad it is and direct the treatment. What are the symptoms or the warning signs of carotid disease? It could be as innocuous as a sudden lapse of memory, not able to come up with the right word, forgetfulness, dropping things from your hand, sudden blurred vision, like a film in front of your eye when you wake up. You rub the eye, but it still doesn't get better. These are very important early clues that we cannot afford to ignore. Prompt attention, taking aspirin in the right setting, and having the doctor perform the right test, which in this case would be carotid ultrasound, could be life-saving.